Health stakeholders were Tuesday gathered in Nairobi as they sought answers over continued dependency on foreign donors to fund the country's health sector.
Kenya has experienced positive economic growth and become a lower middle income country. Thus, we are set to move progressively from external donor financing for health towards domestic funding.
And as efforts to actualize the universal health coverage dream intensifies, calls to tighten the noose on the loads of graft dominated proceedings, with those attending the forum saying it was the only way the country will be able to fund its budgetary obligations.
We have enough money in the country. If you look at the private sector, you look at the insurance, you look at what government is putting, there is enough money in the country to give all of us cover for health. What is the problem? The problem are two. One, inefficient utilization of that money, and two, corruption.
The biggest mobilization of our money will be if we stop corruption. We should follow our president, what Excellency Uhuru Kenyatta is saying. Please stop corruption. We have enough money to give universal health coverage with care.
Health Principal Secretary Peter Tum, however, says the government is working towards ensuring efficiency gains in health delivery through the Sustainable Domestic Resource Mobilization for Health in Kenya blueprint.
Increasing domestic resources for health is important to us. We are keen to secure our health security and safeguard current investments in UHC for perpetuity. We wish to mitigate against global financing transitions and uncertainties of development assistance. In addition to funding more money for health, finding more money for health, our commitment has also included taking a closer look at opportunities for efficiency gains in health delivery, thus funding more health for the money that we have.
National Assembly Health Committee Chair Sabina Chege saying that the Parliament remains committed to support the national and county governments in improving health services.
My priority and the committee priority is reinforcing the resources that we currently have. Currently, the money that we give to the counties don't have a specific percentage that they give to the healthcare. So we are saying the money that is coming from health sector, be it from the national government and even what is collected within the hospitals and dispensaries or the health centers, that money should be reinvested back to health. And with that, then we are going to have enough drugs. We can be able to employ more staff members. We are going to have enough nurses, enough doctors within our health sectors. But once we live with open and it's not reinvested, then that is where we are saying people are walking to a hospital and then they don't find drugs, they don't get doctors. And those are some of the challenges that we hope once we reinvest that amount, then some of these challenges will not be there.
Universal health coverage is part of President Kenyatta's Big Four agenda and calls for scaling up and sustaining interventions for disease prevention, control and treatment. For Channel 1 News Hour, I'm Emily K. Bade.